Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Which all of the following statements about hybridoma is true except in hybridoma specific antibody producing cells. No, in hybridoma myeloma cells with mutation in salvage pathway will grow in heart medium. Okay, we will see some important points about hybridoma technology so that this topic will be done. So if you see what happens in hybridoma technology, so in hybridoma technology, in hybridoma technology, we will fuse the normal antibody producing normal B cell we will take and we will fuse it with a myeloma cell. What is a myeloma cell? It is a plasma cell. It is actually a plasma cell which is cancerous. It is cancerous plasma cell. Okay, when you fuse B cell with myeloma cell, it will produce a hybrid set of cells which are called as hybridoma. This hybridoma will produces antibodies, which is a property of B cell, and it also grows indefinitely or multiplies indefinitely. It is not grows, it multiplies indefinitely. Okay, how are you going to do this? Okay, what is the procedure? The procedure is, first we will take the mouse and you will inject the mouse with the antigen and the mouse will produce B cells. So you will take the mouse B cells from the spleen, and these mouse B cells are HGPRT positive and they also are immunoglobulin positive. These are isolated and these are now mixed with myeloma cells. Now these myeloma cells are actually HGPRT negative and they are immunoglobulin negative. Now, if you see these are allowed to grow in heart medium. Once they grow in heart medium, these will result in production of three types of cells are produced. So what are the three types of cells which are produced? So first and foremost, there will be formation of unfused spleen cells are produced. There are unfused spleen cells. These unfused spleen cells will not grow. So because they will not grow and they will not survive. Okay, then we will also have unfused myeloma cells. These unfused myeloma cells are these do not have HGPRT negative. Because they are HGPRT negative, so they do not perform salvage pathway. They do not perform salvage pathway. Then the third group is we have hybridoma cells. Okay, this is hybridoma cells are present. These hybridoma cells will grow long. So we have got hybridoma cells now. Then the next important thing is we have what is heart medium. So in the heart medium we have three things. H for hypoxanthine, then A for aminopterin, and we have T for thiamine. Purine synthesis in mammalian cells is either by de novo or salvage pathway. This aminopterin will actually block the de novo pathway. So as a result, because it blocks the de novo pathway, the cells, if you see because it blocks the de novo pathway, the cell has to perform salvage pathway only. For synthesis of proteins, it should perform salvage pathway for protein synthesis. For purine synthesis. It requires salvage pathway mainly for purine synthesis. Okay, this is heart medium and about hybridoma cells. Thank you.
thank you and thank you for watching.